Hey, what's going on, everyone? Dr. Taylor, Aspire Chiropractic. Today, I want to talk about something that we all do, hopefully. Some of us do it better than others. Basically, what's the proper way to get some sleep? Every time people come in here, neck pain, back pain, headaches, all this kind of stuff, that's literally, it's stopping them from doing what it is they normally want to do. It's stopping them from wanting to, feel more comfortable at work. It's stopping them from playing with their kids. More often than not, if you got any of this stuff that's affecting your everyday life, it's also going to be affecting your night life, okay? It's going to be affecting how well you can sleep. And doctor, what's the proper way to sleep? I'm going to kind of go against the general convention of thinking here, because if we think about like, what do you think is the proper way to sleep? I don't know about you, but in my head, I envision, freaking Dracula, right? You want to sleep on your back, arms like this or arms at your side, something like that. If we've got, our bed here, right? Supposed to lay like that, just flat on your back. More often than not, yeah, sure. That'll get the job done. Again, if we're following a textbook example. But what I have found in my years of experience, literally, I'm gonna tell you right now, doctor, how should I sleep? Literally, I don't care. I don't care how you sleep, because I want the goal of sleep to be one thing and one thing only, and it's not the position you're in. I want you to wake up feeling rested. So what's the right way to sleep? I don't care. I really don't. As long as when you wake up in the morning, you feel rested. So what can we do to achieve this, to achieve me not caring? Basically, there's three ways to sleep, right? You're either face down, you're on your side, or you're on your back. So if we're on our back, put our bed back here again. If you are a back sleeper, cool. You're halfway there, right? Let's just do a couple things, whether it be on your back, on your side, or on your stomach, that help you achieve restful sleep. So we're in this position here. We're happy. We're sleeping, right? Put a couple of Z's up top here so everybody knows. We want to do a few things. Number one, you don't need a whole bunch of pillows, right? We don't want anything that's going to be cranking your neck upwards like that. So imagine if you're laying flat on your back, you got a bunch of pillows, or jamming your neck like that. Now, this doesn't look comfortable standing up like this. It's not going to be comfortable laying down like that. So you want a minimal amount of pillows, ideally one right under the base of your head that's helping passively mold that curve in your neck. Now, if we got somebody come in here with low back pain, doctor, it hurts to lay on my back. Okay, cool. What we're going to do, we're going to take another pillow. We're going to put it at the foot of the bed, and we're going to stick it right under your knees. It's going to put a little bit of a buckle right in your knees. And what that's going to do, it's going to take that stress off that low back. Real quick reason why. If we look at our spine from the front, we've got our pelvis here. We've got our legs coming out like that. There are two gigantic muscles that literally go from every bone in your low back forward and down into the crease of your hips. It's called your psoas muscle. It's one of your hip flexors. Just remember that part. It's your hip muscle. When this is flat out like that, that muscle is going to be stretched. You put a little bit of a buckle in the knee. That's going to take the stress off those muscles, which is going to take the stress off your low back, which is going to help us achieve what? Restful sleep. So if you're already a back sleeper, like I said, you're halfway there. If you just need a couple of tweaks, those are two things you can do. A minimal pillow underneath your neck and or the base of your head, not 3, 4, 5 of them all jacked up like this, and then one underneath your knees just to put a little bit of a buckle in it. That'll take that stress off that low back. Next option. Dr. Taylor, I'm not a back sleeper. I'm a side sleeper. Okay, that's fine. So here we are. We're looking at you. This is you sleeping, right? Like that, like that. There's a couple of legs. Put an arm right there. Again, you smiling because you're sleeping. The Z's still exist. So if we're a side sleeper, we'll throw the bed in you. Got to put a little 3-dimension on it like that now. But there we go. So how do we achieve better sleep when we're sleeping on our side? Number one, we're going to take that same pillow that we used before. It's going to be a smaller one. And all we want to do, we're going to draw some shoulders in here. We want the pillow to fill the gap between our head and the mattress. So again, if our mattress is here, we don't necessarily want to be lying like this. Again, whatever position you're laying down in, just do that standing up and see if that's comfortable. If it's not comfortable standing, it's not going to be comfortable laying down. So you want a pillow that is literally wide enough just to fill the gap between your ear and the mattress. So that way we keep that spine neutral. Now everyone's going to ask, what pillow should I use? Again, back to how we started this. I don't care. Whatever fills that gap there that allows you a restful night's sleep. Number two, when we're on our side here, a lot of people come in, man, I got these shoulder problems. Do you sleep on your side? I do. Okay. Why did I ask that? Because your shoulder is going to be rolled forward like that, and it's going to compress everything up here. So easiest way to avoid that, another pillow, just give yourself something to hug, something to just, again, fill the gap. Notice a common theme here when we're on our side. We want to fill the gap between the ear and the mattress. We want to fill the gap here in front because it stops our shoulders from collapsing forward. People coming in, I'm a side sleeper. Okay, fine. We've covered that. I got low back pain or hip pain. How do we fix that? Easy. Another pillow. Take a pillow, throw it between the knees. What it's going to do, it's going to help balance out your hips when you're laying on your side. Because again, if we're on our side and we got that one leg that drops over, it's going to torque that low back and it's going to bring those hips forward. We put that pillow right through there. That's going to level out the hips. We got the pillow up here that we're holding on to. That's going to help decompress our shoulders and our chest up front. And we got this third pillow here under our head. That's going to basically cover the gap between our ear and the side of the mattress. So if you are a side sleeper, you have a little more necessity. You're being a little extra. It's totally fine. You just need a couple extra pillows. Last thing here, Dr. Taylor, I'm a stomach sleeper. All right, so let's take a peek at this from the top this time. We're going to go like that, stomach sleeper. So we'll go here. There's a leg probably like that. That thing's sticking out. That arm's up there. Who knows what that one's doing? And you're not as happy because stomach sleepers are going to notoriously have neck pain, upper back pain, probably headaches, things like that. And again, going back down in here in the low back, because everything, you're torqued all night long for 5, 6, 7, 8, 9 hours, depending on how many hours of sleep you get per night. So, Dr. Taylor, I'm a stomach sleeper. I've got all this stuff going on here. You can't really reinforce that with pillows per se. So what we're going to do, we're going to make you feel like you're on your stomach. But again, with the magic of pillows, we're going to put just kind of a little bit of a twist in you. So this one's a little harder to draw. If we're a stomach sleeper, we're sleeping like this and like that, and mattress is here. Put a pillow under just one side of your chest. And all that's going to do, it's just going to kind of just roll you onto your side a little more. But again, we need minimal pillows up here under our head because that reduces the crank and the strain on the neck. Because you got to remember, your body gets used to whatever you do most often. A lot of times we talk about that in the context of your 40-hour-a-week hobby, right? Your job. Same thing goes when you're sleeping, though. They say, I haven't done the math, but 8 hours of sleep, that's a third of the day, probably about a third of your life sleeping. Your body's going to get used to this kind of position. That's why I tell people, like, hey, I'm a stomach sleeper. Should I sleep on my back? No, because you're not used to it. It's going to take forever. Changing the way you sleep is right up there with like quitting smoking and dieting for the world's hardest things to do. So let's take what you're already good at, hopefully, sleeping, and just make you a little better at it. If you're on your back, pillow under the neck, pillow under the knees. If you're on your side, pillow between your ear and the mattress, pillow for you to hug, pillow between your knees to level out your hips. If you're a stomach sleeper, pillow underneath your chest. Heck, maybe even one under your knee here, because all we're trying to do is just achieve a little bit more of a roll, because the grand goal in all this stuff is to keep the spine as neutral as we can, disrupt your sleep as little as possible, allowing you to get the most restful sleep that we can. So, Dr. Taylor, how should I sleep? Man, I don't care. As long as you're sleeping in a way that provides restful sleep, so you wake up in the morning feeling better than you did when you went to bed. Now, on top of all of this, we talk about these different positions that are causing you stress and things like that when you're sleeping. If we've got our spine and your head here, our spine going down like that, we've got 24 bendable, movable, twistable bones in this thing we call a spine, right? It's a flexible bony tube. And if we've got subluxations in here, if we've got bones that aren't moving properly, they're causing different muscle spasms, going up and down like that or up and down like that, that's going to inhibit us from getting that restful sleep. This is the I just can't get comfortable. So we've done all the pillow stuff. We've got all the mattress stuff. Next thing we got to do is we got to make sure your body can actually rest. Because if we've got these segments out of place here, they're going to cause those muscle spasms. They're going to cause those irritations, that swelling. It could even be numbness and tingling if we're pinching on nerves. And if we've got all that stuff going on, we're not going to get restful sleep. So between your pillows and your chiropractor, I should be able to get you a solid 6 hours maybe even 7 or 8 if you don't got kids running the room waking you up. Now, if this is something that just makes sense to you, if it seems like, shoot, just the last piece in your puzzle, if you got questions about it, just give us a call, walk right through that door. I'm ready to help you when you're ready to get your best night's sleep right here at Aspire Chiropractic.